A lot of people turn to Dr. Google to self-diagnose health symptoms and get medical advice. But you know what? Online symptom checkers are only accurate about a third of the time. This is according to a new research published in the Medical Journal of Australia. Dr. Jason West is an integrative medicine physician. He's the fourth generation owner of West Clinic in Idaho. And Doc, we know people check in with Dr. Google, but do they really think they have a diagnosis?
Well, you would be surprised on how many people that actually come in and say, here, this is exactly my disease. And I'll say, where did you get that from? The University of Utah, the Mayo Clinic? And they'll be like, no, I put my symptoms in Google, and this is what it says that I have.
Oh, boy. And it's usually something deadly, right?
Here's a perfect example. I had a patient come in that had, they get stressed and their eyelid twitches. And so they went to Google, they typed in muscle twitching, and one of the first things that comes up is this very rare disease, Lou Gehrig's disease, and they're like, hey, I've only got a couple more months to live. I'm dying from this disease.
Oh, no.
And I said, well, wait a minute. You know that there's another disease called benign fasciculation syndrome, which is really just your muscles twitch. There's no reason why. It's not serious. And so there's the spectrum. And so it's good that people are educated. But the internet has a tendency to make you think that you have the very worst thing that can happen, not the most likely thing that will happen.
I wonder why people are doing this. It seems like it's more and more prevalent. But then again, we didn't have Google, 15 years ago? So
it's true. And one of the things that I tell people is in the office, people want to come in. They want to know what's wrong. Can you fix it? How long will it take? How much will it cost? How can you make it so that it doesn't come back? And when you give a patient a diagnosis, I'll say, hey, look, before you leave the room here, let's just jump on Google and let me tell you what some of the stuff that you're going to see so that you don't beat yourself up and turn yourself into this hypochondriac.
All right. So, when it comes to trying to find out what your symptoms are and, if it's serious, can you get at least an idea, that muscle twitch, et cetera, if you should go to the doctor or should you just go to the doctor?
Well, part of it is the doctor's fault. I mean, I got to own up for the healthcare providers because you just can't tell people this is what you have and then they'll take it and say, okay, that's what my doctor told me this. They're on it. And it's such a good thing to have people aware of their conditions and symptoms and what they're doing. I mean, that's the good part. The bad part is when you get poisoned information and then you're thinking, hey, I have something that's really serious, and the likelihood of you having benign fasciculation syndrome is really high, and the likelihood of you having, a really serious disease is low. So it's good and bad, but we're in this situation where people have a lot of time on their hands. We're outside of the norm. They're looking for something, and they're saying, hey, you know what? I've got this weird pain in my stomach. And the next thing they do is they're coming in and saying, I've got pancreatic cancer.
Ooh, Lordy. Okay. Yeah, that's a little bit scary. All right. The bottom line, just go talk to your doctor. Dr. Jason West, integrative medicine physician in Idaho at the West Clinic. Thank you so much for your time.
You're welcome. Stay safe and stay healthy.
All right. You too.